Nystagmus is a vision condition in which the eyes makes repetitive, uncontrolled movements, which is result to a reduced vision and depth perception and can affect balance and coordinations. Nystagmus, also called dancing eyes and jerking eyes. Nystagmus can be an inherited condition showing up in early childhood, or it can develop later in life due to an accident or illness. These are the some causes of nystagmus, including being passed down from your parents, other eye issues like cataracts and strabismus, diseases like stroke, multiple sclerosis, head injuries, albinism, certain medication like lithium or drugs for seizures, alcohol or drug uses, and sometimes the cause of nystagmus is unknown. Nystagmus may be horizontal, vertical, rotary or torsional, or any combination of these movements. Nystagmus may be conjugate or disconjugate or dissociation. These are the signs and symptoms of nystagmus. Your eyes move without your control. It might be fast, then slow, then fast again. The movement might be in one eye, but usually in both eyes. You may notice that you nod your head or keep it in a strange position. You do that because it helps you to focus when you can't hold your gaze steady. Things look clearer when you tilt or turn your head. Objects may seem a little blurry to children with nystagmus, but the world doesn't look shaky to them. It is different if you develop the condition as an adult. Then the world appears to move a little when you look around. Nystagmus may also affect your vision. You might have a hard time seeing in dark, or you may be sensitive to bright light. You may have problems with balance and dizziness, and it can be worse if you are tired or stressed.
There are two classifications of nystagmus. It is physiological and pathological. In physiological, it includes end-gauge nystagmus, rebound nystagmus, and optokinetic nystagmus. For the pathological, it includes seesaw nystagmus, upbeat nystagmus, downbeat nystagmus, dissociated nystagmus, convergence nystagmus, and torsional nystagmus.
For physiological nystagmus,
Rebound nystagmus. It is due to prolonged eccentric viewing, due to a directional bias in the ocular motor control in an attempt to control the centripetal tendency of the eyes to return to the primary position. A few bits of rebound nystagmus may be seen in normal individuals. More persistent rebound nystagmus is a sign of cerebellar disease. End-gauge nystagmus. There are three forms to describe. First one is end-gauge fatigue nystagmus, which is it occurs after there is prolonged 10 to 15 seconds deviation of the eyes in the eccentric position. And the second is unsustained end-gauge nystagmus. It is an ill-sustained nystagmus like movement seen at extremes of gaze, usually resolves within 5 to 10 seconds. And the third is sustained and gaze nystagmus. There is sustained horizontal and gaze nystagmus in the extreme of gaze. The nystagmus resolves only when the eyes return back to the primary gaze position. Optokinetic nystagmus. It refers to the jerk nystagmus induced by full-field visual motion. Optokinetic nystagmus is usually induced by full-field projected stripes or a motor-driven visual surround. True optokinetic nystagmus cannot be induced at the bedside where actually ocular pursuit is being tested.
for pathological nystagmus,
Torsional nystagmus. It is refers to a rotary movement of the globe about its antero-posterior axis. Torsional nystagmus is accentuated on lateral gaze. Dissociated nystagmus. It is refers to the two eyes having nystagmus with the same direction but with differing amplitudes. Seesaw nystagmus. It is a pendular oscillation that consists of elevation and intorsion of one eye and depression and extorsion of the fellow eye that alternates every half cycle. Upbeat nystagmus. It is a type of central vestibular nystagmus. It can be caused by lesions from the medulla to the midbrain. It usually increases in up gaze but not on lateral gaze, and fixation does not dampen it. Downbeat nystagmus is characterized by a pathologic upward drift of gaze followed by a corrective downward saccade. Downbeat nystagmus is the most apparent when the patient is instructed to look down or to either side. It is typically accompanied by oscillopsia, which may be severe. Convergence retraction nystagmus is an irregular, jerky nystagmus in which both eyeballs rhythmically converge and retract into the orbit, particularly on attempting an upward gaze.
Nystagmus related to low vision. Early onset nystagmus often accompanies vision loss acquired at birth or soon after, and may be one of the first signs that a child has loss of vision. It is a side effect of vision loss from eye diseases such as albinism, aniridia, optic nerve hypoplasia, achromatopsia, congenital cataract, coloboma, or retinopathy of prematurity. Nystagmus can be acquired later in life due to neurological dysfunctions such as head injury, multiple sclerosis, or brain tumors. Medication. Several surgical procedures have been developed to reduce null position and thus improve a patient's cosmetic appearance. We use some drugs like Botox. Botulinum toxin has been used to paralyze ocular muscles and thus reduce nystagmus. It has not become a practical treatment since the effect of this drug lasts only 3 to 4 months and require injection into ocular muscle under general anesthesia. And also baclofen. Baclofen has only been used to lessen certain forms of nystagmus.